Hi ladies, so I thought I would give you a little update. Today I am 5 DPO, so 5 days past ovulation according to Fertility Friend and my OPKs. I did end up getting OPKs, I had like many days of positive OPKs and very positive OPKs. And I just stopped testing at cycle day 21 or 22, I can't remember, because I was like, yeah, okay, I've just got to stop. But Fertility Friend is giving me that, like, I ovulated on cycle day 19, so around then I ovulated. I went in for my progesterone, to give my blood for my progesterone, and I got the levels back today, and I got a 16.1, which is consistent with a good ovulation, so I'm definitely in my luteal phase, and it's obviously too early for implantation or anything to occur, and, we're hopeful. My doctor in the message said, we're thinking of you, and, this is consistent with good ovulation. So there is a chance that we conceived. So who knows? We'll see. As far as symptoms, like days past ovulation, I really haven't had any crazy symptoms or anything. I really haven't. I haven't been very good about my diet this week. I was doing like no carb, and I've been doing a little bit of like rice and a few carbs here and there. So, I don't know. I've just really needed that. So I've been really hungry. So, and that usually happens to me in my luteal phase. I just need like carbs. So I've allowed myself, a cheat day today. And, so anyways, yeah, so, we're, hoping that this is our cycle. We'll see, we have no idea. I was kind of, annoyed or frustrated with my doctor's office when I went in yesterday because, this month I got the lowest estradiol, levels that I've had. So I'm in the 3rd cycle of Clomid. The first 2 I did 50 milligrams, and this 3rd one I've done 100. And the 50s, I had the first time it was my levels were in the mid 400s. Last cycle it was over 1,000, which I'm pretty sure I hyperstimulated, and my progesterone was 24 or something. So I think I might have hyperstimulated last month. I don't know though. I don't know. That's just by my research, because when I went in yesterday to kind of seek out some answers and find out, what they knew or, could speculate on, why my levels are lower this month, because now they're 364 this month was my estradiol, which still is good. It's still ovulation, but it's just lower. So my question was, why is it lower on 100 than it was with 50? And she was, the nurse that always takes my blood and stuff, she's always very helpful, very sweet, but she's very rushed, And we spent the whole time while she was getting my blood talking about her daughter and how her daughter had gotten in an accident with a deer. She's fine, and everything, but, and I'm fine with that. That's fine, but I had questions. So had I known that our time was going to be very short and needed to be rushed, I would have said, I would have asked her immediately. But usually we have about a few minutes in between her next patient or whatever that I can kind of ask her questions, stuff like that. And this time she just kind of got up and started walking away, and I was like, oh wait, I have a question for you. And I was like, should I be worried that my levels were lower this first round of 100 than when I was on 50? And she was just looked at me kind of weird, and then she was like, I don't know what your levels were and I don't know right now. And I was like, well, I can pull them up, and she was like, well, I can't right now. And I was like, okay, I would have waited, whatever. And she just said, let me give you a buzz later. I said, yeah, because I have a few other questions. Never received a phone call or anything. And then today I received the progesterone levels, but not, any sort of indication, which I guess maybe she thought by saying this is consistent with a good ovulation, that would satisfy that question that I had, but I had a few other ones. So yeah, I don't know. That was like kind of the first time at that doctor's office that I've gotten kind of like, excuse me, but, and I don't know, this is so silly of me, but I know I can talk to y'all about this. No one else would get it. They'd just think I was crazy. But there was a lady in there. It was just me and this other lady in the waiting room, and she was just like, did not seem very happy to be there. And of course, I was just being nosy and listening in on what was going on because I was so confused. And she was in there to get a beta test done because she had gotten a positive urine pregnancy test. She already has like a 4-year-old, and now she's having a second baby. And, she just was kind of like not really into it, and I don't know, there could be many other factors going on that morning that could have led her not to be totally elated. But I think what made me like kind of really annoyed with my situation was because the nurse was rushing me along because she wanted to, do the pregnant lady's blood tests. And there was no one else in the waiting room. There wasn't like they were like slammed or anything. And I was just thinking like, I know that I'm not super important patient right now because I'm not pregnant. You're not going to make a lot of money off me right now. But I'm still a patient and I deserve a few moments of your time, because this is a very confusing, system for me. Like that, this is a very confusing time. And so, yeah, I don't know. But I think I was just being super sensitive. And I think that if this isn't our cycle, I think I want to meet with my OBGYN again and ask her if my ovulating cycle days 17 through 20 is too late, and to see if, we should maybe think about doing an IUI so we don't waste a Clomid cycle, because we have 3 cycles left after this one. We'll have 1 at 100 and then 2 at 150. So, I just don't want to waste time, I really don't. So I don't know whether I should see if I can get a recommendation of an RE or stick with my OB and just wait another, 3 cycles after this one and see if that works and then move towards the RE. So I don't know. These are just all things that are kind of going around in my head, and my husband, bless his heart, but he tries to understand and he tries to understand and be supportive, but sometimes he just doesn't he doesn't know. I'm like, well, should we go to a different doctor, and he's like, well, it's one time that you felt uncomfortable, but he's like, I know how difficult this is for you right now, so if that would make you feel more confident and better, then we'll do that, But unfortunately, all of our REs are like an hour or an hour and a half away that are within our insurance. So we'll just see. I think our plan, and I think we kind of decided that we would wait this cycle out, see if it works. And if it doesn't, then I'm definitely going to mention to my OB when I call in to get my prescription for Clomid. I'm definitely going to mention to her, the lead nurse, that we'd like, if they offer IUIs, I don't even know if they do, we would like to possibly do that, see about that, research it a little bit. And then, or if, by this last cycle on 100, I don't know whether I want to do 2 cycles at 150 without consulting an RE, because I just don't want to be wasting Clomid cycles. So, I don't know. I'm all over the place. So, if you have any information or kind of just anything, you know, if you think that I'm, you know, jumping the gun and I should just wait it out, let me know what you think, you know. Do you find that even though your OB was very forthcoming with helping you with fertility treatments, did you find that your RE was better? You know, should I just bite the bullet and do it now rather than waste time? So let me know what you think. And then that's about it. So I'm in my 2-week wait. I'm not going to test until probably at least 10 DPO. My in-laws are coming this weekend from Thursday till Sunday. So 10 DPO will be... That's me thinking. Will be Sunday. So I don't want to test before because I don't want to be depressed while they're here. So I think that I will probably wait to test until either Sunday or Monday. And then that'll be 10 or 11 DPO. And then I typically have a 12-day luteal phase. So if not, then Aunt Flo should be here by Tuesday or Wednesday or Thursday. So we'll see. I'll keep you updated. Thanks a lot for watching.